Buko lang ng 2019, national election, ngayon 2022 na naman. So, medyo mabigat, no? I was prepared for 2019, kaya hindi ko makalain na hindi ako swerte doon. So, yung budget-wise, I think talagang malaking problema, no? If you can, from the very start, no, ang hirap na hirap kami dahil wala na ako TV ads yung una, wala mga, if you can see, wala rin ako mga paraphernalia at the very start. So, those are the challenges. Second, I don't have a major presidential team that I go with, no? And I'm NPC but I campaign as an independent, no? Mag-isa lang akong magalaw. Wala akong built-in crowd na pupunta ka lang, magpapakita, nandun na yung libo-libong crowd. Wala ako nun. Third, alam niya naman, to mention this, although as much as possible, I want to refrain from the issue of the civil rights, hindi kaya lang, kasabay na naman kami tumakbo, like 2019 all over again. So, given all of these three factors, I would say this is the most challenging campaign that I have entered into. But, alam ko na mangyayari to pero when pandemic struck, I saw the weaknesses of our healthcare system, mas lalo na expose, mas lalo na exacerbate. So, dito ko nagdesisyon na sabi ko, sayang kung yung universal healthcare law was implemented properly and given much importance, it could have helped so much in this pandemic. Kaya nga sabi ko, kahit mabigat ang laban, ako'y lumaban. At dahil misyon at obligasyon ko na tapusin ang universal healthcare law, dahil pangako natin yan, na guminawa ang buhay ng bawat Pilipino. The universal healthcare law, no doubt, is an ambitious measure. It seeks to give access to good quality healthcare for all Filipinos without the financial burden. So, it's a 10-year program, so it's still a work in progress. Bagamat pasado na, it's a landmark legislation. Marami pang kailangan tapusin at ayusin at gawin. No? Una-una, under UHC, all Filipinos will now be automatically considered a member. No? Dati, yung regular employees lang, both government and private and business, ang members ng PhilHealth. But now, even the indigents, yung may hirap, senior citizens, and PWDs will now be considered as member and will be subsidized by government yung kanila pong premiums. Magandang balita po rito, yung mga binanggit kong sector, no? Yung indigents, PWDs, and senior citizens, ang target na natin talagang zero balance billing. Ibig sabihin, wala sila dapat bayaran pag sila po ay ma-hospital. Yes, it's ambitious, but it can be done. Kasi ginagawa na sa ibang bansa yan, pero ginawa rin yan sa mga ginagawa, especially in the first world countries. But in Thailand, they are able to do it, which is a third world country like ours. So sabi ko noon, kung kaya nila sa Thailand, dapat kayanin din natin. So, pinag-aralan natin ng maigi where to get the sources of funding, kung paano implement, and sa awa naman ng Diyos, ipasa natin yung 2019, no? Just during the campaign. February, with the sake of, napirma ni Presidente ito, February 19, 2019. So, it's in the third year of implementation. But as I mentioned, it's a work in progress. Marami pa kailangan gawin, tulad ng improvement ng health facilities, kasama rin po yan, to improve all the health facilities, provincial hospitals, city hospitals, primary hospitals, and rural health units, because that's part and parcel of universal healthcare law. Now, yung health facilities enhancement program. We will also establish a lung, kidney, heart, and cancer centers in strategic areas in the country. Kasi po, ang problema ngayon, those coming from the far-flung areas, Mindanao, Northern Luzon, Bicol, kinakailangan pumunta pa sila dito sa Philippine Heart Center dito sa Quezon City, National Kidney Technical Institute, or Lung Center of the Philippines for special cases. But under the UHC, which we push, we will establish one in strategic areas para hindi na mahirapan. No? We have in Northern Luzon, we have in Bicol, we have in Soto in Cebu for Central Visayas, both Bohol and Cebu provinces. We have also in Western Visayas Medical Center for Panay Island and Negros Island. Meron din sa Cagayan de Oro for Northern Mindanao Medical Center and Southern Philippines Medical Center in Davao for the Southern Mindanao provinces. So, napakaganda talagang batas na ito. Sayang naman kung hindi ma-implement ng tama't maayos and given priority kasi andyan yung opportunity. No? It's an opportunity for us to be able to enjoy a genuine universal healthcare. No? Na siguro tatanungin nyo bakit ko pinush to. I was a mayor for 9 years, and lumaki rin ako sa barangay, and I had the chance to immerse in mingle with the ordinary folks, no? Dahil pag mayor ka, lahat nakakausap mo, and I would say 80% of the time na lumalapit sa akin na humingi ng tulong, it's more of medical assistance. Napakabigat, magkasakit, lalo na kung may cancer o kaya dialysis, lalo na kung tumagal ang hospitalization. Naubos ang ipon, mamaya maunang maubos ang savings, mamaya magbebenta na ng kagamitan, mamaya magsasala ng lupa. So that has been the story of the lives of the ordinary Filipino na walang pambayad, na napakabigat. That's why when I went to the Senate, I had the chance, binigyan ako ng break. I was designated as chairman of the Committee on Health. I pushed for the universal health care. At sa awa naman Diyos na ipasapin natin. So it's really, I'm also the principal sponsor and author of this measure, which is to improve the housing program of government. Now that we have a full-fledged department now taking care of the housing program, pinapakita na ng gobyerno, seryoso na po ayusin ang problema sa babahay. Target natin, in 30 to 40 years time, dapat wala nang tawaging squatter sa sariling bayan. Government will now be providing affordable and decent housing to all Filipinos. So yan po ang ating pong target, no? By pushing the Department of Human Settlements and Urban Development. Last on my list, yung sa aking 3 priority areas, no, that of concern in case we get back to the Senate. I want to pick up where I left off. I was the one who defended most of the DOTR projects during the Duterte administration, yung build. I pushed and I defended most of the railway system projects, yung North-South Commuter Line from Laguna, Metro Manila going to Clark, yung North Line from Clark going to La Union, and the Mindanao Railway System, which will be a first in history. Ay ako rin po nagdepensa at nagtulak, ginagawa na po lahat yan. Ang kulang na lang yung Bicol Line, yung Bicol Express, no, na I hope, sayang yung 3 years, sana na-push din natin yan. I want to really push for it, dahil yan ang kailangan talaga natin sa Bicol. Because Bicol is such a beautiful and a rich region. Sayang lang because of distance, para na-isolate sila. So with the introduction of the railway system, that will stimulate economic growth in the area as well as in the other areas. Tatanong nyo bakit po tinutulak ang railways? That will produce jobs and opportunities. No? Alam ko marami na nga ako na, pero ang tingin ko ito talaga magdadala ng trabaho at hanap buhay, especially in the provinces. Ngayon, lahat magsisiksikan sa Metro Manila kasi nandito ang growth area, nandito ang opportunities. So with the introduction of the railway system, it will spread out the development. We will create growth areas in all the provinces. Magkakaroon industrial parks, commercial centers, food terminals to support agriculture. So yung trabaho at hanap buhay na matagal na marami pong ability in the provinces alone, magkakaroon. So that's why I'm pushing for massive infrastructure development, because this will create growth areas and stimulate economic growth all over the country. So those are my 3 priority programs right now, which are all designed to improve the quality of lives of our people. One for healthcare, one for housing, and one for jobs and opportunities through infrastructure development. So yun po, and I'll be open to any question later. Good afternoon, everybody. In 2019, I was an incumbent electionist. Kapapasa ko lang ng Universal Health Care at Department of Human Settlements and Urban Development. 2 landmark legislations. Nakakala ko it will be a breeze, no? Nakakala ko magiging madali kasi 2 landmark ito eh, no? Kaya lang, it was passed during the campaign season already, kumbaga hindi na na-disseminate siguro at hindi alam ng tao pa kung ano yung 2 yun. Pangalawa, I was also part of the hukbong ng pagbabago, yung grupo ni Mayor Inday Sara, na kasama ko ng kapatid ko. I think during the whole campaign, what was highlighted was the sibling rivalry issue kasi we were on the same stage. No? So, sayang, Universal Healthcare, Department of Human Settlements, hindi man lang ito napag-usapan during the campaign period. So now, of course, I have to admit, napakahirap talaga itong kampanya ito. Ang hirap mag-isa. Although nakakapunta naman ako minsan sa kina Senator Soto and Lason, kina Yorme, kina Pacquiao, those who have adopted me, also to send my thanks for adopting me as a guest candidate. Wala ako ng big in crowd, no? Tulad ng Unity, o kaya yung mga kay Lenny Kiko na ang lalaki ng mga crowd, no? Yung pupunta ka lang, ando na yung crowd, na libo-libo. Kami, solo lang, minsan pupunta kami, hindi namin alam kung sino siya sa lubong, pero ganoon talaga. That's part of the being independent candidate, no? Pero I think it is also it's a blessing in disguise that I am moving alone because I'm able to elaborate more on my accomplishments, universal healthcare law, Department of Housing, and my push of infrastructure development, my platforms, and my plans, no? Mas na-focus sa akin, no? Instead of being in the presidential team na ang dami-dami yun, na ang focus will be the presidential, vice presidential candidates. So I think that's the one that is working for me this time, and probably people now are more aware of universal healthcare law kasi 3 years na siya na-implement, and a lot of the people have already benefited, lalo na time ng COVID, lahat na na-COVID, na-cover ng PhilHealth kasi po sa universal healthcare law. No? So people, I think, are appreciating what I have done in the Senate. So, surprisingly, matagal ako sa politika pero iba yung feel ko ngayon. In all the provinces that I have visited, sobrang init ng reception, no, ng pagtanggap sa akin. Hindi naman ako showbiz, hindi naman ako popular, pero ramdam mo yung init. Mas mainit siya for some reason than 2019 kung kailan nakaupo ako. It's probably the appreciation and recognition of my efforts when I was in the Senate. So, yun nga, minsan kala ko artista ako buti na lang nagigising ako, hindi pala. Ibig ko sabihin, ganun kainit yung pagtanggap sa akin. No? It's really heartwarming na minsan, I have to admit this campaign is full of ups and downs, diba? Dahil sa challenges that I am facing, pero pag gano'n naman yung reception sa inyo, syempre lakas na loob, nakakawala ng pagod. So, I think that's the one that's working for me now because as an independent, I am able to elaborate more and speak on my own issues, speak on my platforms and plans, and speak on the accomplishments, especially universal healthcare.
Okay.
Well, actually, ang universal healthcare law kasi is intended to overhaul the whole healthcare system of the country. Kaya nga 10-year program to. No? Kaya kahit pasado na yung batas, it's a work in progress. Kaya nga that is the reason why I would want to go back to the Senate para mabantayan ko ang implementation. Because although marami naman na pumalit sa atin nung nawala ako doon, but as principal sponsor and author, you know the history, the purpose, and intention of the law. Dahil ikaw ang nag-conduct ng hearings ng TWGs, I was the one who defended it on the floor. So, malaking tulong, malaking advantage of the wisdom of the principal sponsor is there during the implementation phase, lalo na yung infancy, no? Kailangan mabantayan talaga. Nabanggit ko kanina yung healthcare facilities, no? Dati ang mga ospital pag gobyerno, talagang dilapidated, luma. We have started increasing bed capacity, improving the facilities, and putting new equipment. So, kung buong probinsya yan, lahat ng probinsya yan sa buong Pilipinas, that would take time. Pero nagsimula na tayo, no? May mga ospital na tayong napagawa in my incumbency as chairman of the Committee on Health, in time with the universal healthcare law. Second, yung problema sa healthcare workers, itong pandemic, lumabas din na they are really, sila na nga yung food soldiers natin, hindi pa naman bigay ng gobyerno yung benepisyo, yung mga privileges nila. No? Ako naman, tingin ko, if you can only increase a little bit yung kanila pong compensation justly, because they are our food soldiers right now, mabigay ko yung privileges, benefits, yung konting pag-aruga ng gobyerno, PPEs, food allowances, they would choose to stay here than to be away. We cannot match the lure of greener pastures ng mga ibang bansa dahil definitely mas malaki yung kanilang salary. Hindi natin kaya. But if you can increase it a bit, just like what we did for the men in uniform, PPLP natin, itaas natin ang sweldo, then I don't see any reason why we should not increase the food soldiers of our food soldiers during this pandemic. Sila ang ating pang frontline, yun talagang frontline. So ako, I would like to give priority to that, no? Kasi nasa batas din yung guarantee of the supply of healthcare workers, which includes nurses, healthcare workers, and doctors. No? Yun lang, babantayan natin. Last, yung problema ng PhilHealth, lagi ever since it has been saddled by problems, scandals, and scams, we seek to rehabilitate because we have no choice. We only have one health insurance agency, that is PhilHealth, that tasked to implement the universal healthcare law. hindi lang naman kasi kasalanan ng PhilHealth yan, no? Minsan, it's a collusion, no? Minsan may mga hospitals, may mga doctors, and PhilHealth personnel that have conspired, no? Para pagsamantalahan, no? Ang pondo ng PhilHealth. For example, yung cataract scam, siguro narinig nyo na yun, that cost hundreds of millions sa PhilHealth. Kahit hindi kailangan ng operahan sa katarata, ino-operahan para makakolekta. Yung upcasing, for example, bronchitis lang, ubo lang, gagawin pneumonia. Dapat 3,000 lang ang makukuha, magiging 15,000. Pag pneumonia, gagawin severe pneumonia para maging 30,000. Just imagine kung ilang libo ang gumagawa niya, o milyon ang gumagawa niya, that will really bleed the PhilHealth's coffer. So, we have to rehabilitate, we have to prosecute those who are involved sa mga scam na yun. We investigated that, but I was in the Senate. Kailangan di makulong talaga, just like in any other government agencies. Dapat meron talagang masampulan para magtanda. That's one of the problems of our country. Wala tayong big fish na naririnig na napapakulong. Diba? So, yan po, yung rehabilitation ng PhilHealth to make it more effective, dapat ang makakuha ng assistance, yun talaga nangangailangan. So, that made me decide to run again in spite of the situation. Kasi sayang, no? The universal healthcare could have helped a lot in this pandemic. So we have to survive this first. Malaki may tutulong na ito. It just has to be implemented properly. For example, ang budget ng UHC supposedly 257 billion for the implementation. Ang naipapasa lang 170 billion. Kumbaga nasa low end tayo. Kaya hindi natin ma-cover lahat. Diba? Sayang. Diba? Otherwise, paglalaban natin yan. There are other agencies, departments, mga underspending na hindi ginagamit yung pondo. Yun ang kukunin natin to cover the universal healthcare. Sa akin, talagang itong pinaka-importante. We can make sacrifices elsewhere, but not our healthcare system. Thank you. As I mentioned earlier, lumaki po ako sa barangay. No? Kahit anak ako ng mayor era ko, naging vice president, sila doon. Doon ako tumambay, basketball noong una, tapos doon natuto uminom, standby sa kalye. At that early age, I was able to immerse already with the ordinary one de la Cruz. At nakikita ko yung problema kapag mayroon talagang sakit sa pamilya. Lalo na nung nag-mayor ako, lahat na lumalapit sa akin is more of medical assistance. At napakabigat. Sabi ko nga, pag nagka-cancer o dialysis 3 times a week, that's 9,000 a week. Napakabigat yan for any ordinary employee. No? Kaya, mamaya, sabi ko nga, nauubos ang savings, unang-una, nauubos ka agad, nagbebenta ng gamit, nagsasana ng lupa. So that is the reason probably why I really pushed for this universal healthcare law when I had the chance and opportunity to be in the Senate. No? Para, naalala ko 2013, when I first ran, sabi natin, gusto ko maginhawa ang buhay ng bawat Pilipino. At isa sa pinakamabigat na pinapasa ng bawat Pilipino, yung medical expenses. So kung makagaan man na tayo dito, yung perang pinaghirapan, pinipon, mga ari-arian ng bawat Pilipino, dapat magamit niya para sa kanyang pamilya. Hindi dapat maubos sa isang pagkakasakit. So, ayun, at least kung ito makagaan tayo, makatulong gobyerno dito, maandyan ang gobyerno para malalay, malaki may tutulong sa bawat pamilya kasi magagamit na nila yung kanyang pinaghirapan para sa pamilya. Thank you, already 2019, although latter part na. No? And I think nag-click yun, especially yung jingle ko, tsaka yung branding. Ngayon kahit saan napunta, alam na yung good one. No? Even kids, mga bata, matanda, lahat, kinakanta yung jingle ko. Pag kinanta na yun ng bata, ibig sabihin successful ka na. So there's no more need to rebrand. And I think, if the product is good, there's no need to rebrand. Hindi mo kinakailangan magpapago, di ba? It will sell itself. Ay, sa tingin ko naman, without the 3 factors, I think I would malinis man kasi yung track record ko. I have no issue of corruption. In my 18 years of being a public servant, I have never been involved in a scam or scandal. That's why, sabi ko, my name is unblemished. So, with performance, I think I'm really an easy candidate to sell, no? But given the factors that I mentioned earlier, hindi ko rin maintindihan bakit yung iba hindi ako sinama, ay hindi naman ako bagahe. Pero, andun yan eh. That's part of the challenge. Pero sa tingin ko ngayon, everything happens for a reason. You know, with the challenges, wala akong partido, limited ang budget ko, kasabay akong tumatakbo. Parang it was an uphill battle all the way from the very start. Napakahirap, no? But for me to be ranking this high already, no, at least pasok na ako sa top 12 in most survey firms, minsan 12, minsan 7, minsan 8, no? So parang tingin ko may tulong na to eh. May tulong na to sa Diyos kasi napakabigat talaga ng pinagdadaanan ko. Kaya nasabi ko highs and lows itong campaign na to. But siyempre, papalakas na loob sa akin every time I visit a province or cities in Metro Manila, yung reception, yung very, very warm reception ng tao and the support of, support pa ako ng mga governors and mayors that I visited. Siguro because may performance and track record. Siyempre, yun yung papalakas na loob ko. Na sabi ko nga, bigat ng kampanya to, napakabigat ng laban, pero I have a mission and obligation to fulfill. Kailangan matapos ko universal healthcare para mas maramdaman to ng ating bayan kasi kung titignan ko lang ang resume ko, no? Palagay ko, quota na ako, 2 landmark legislation yan in 3 years. In my 6 years in the Senate, diba? Marami pang significant laws. Kung titignan mo yung resume ko, quota na. Pero ayoko naman ng half-baked. Gusto ko yung talagang tapos na. Yung mararamdaman na yung bawat individual. So, I think, yun yung papalakas loob ko kasi may mission at obligation tayo kahit na mabigat ako. Pero very tricky at mahirap. Sa divorce, we are a predominantly Catholic country. No? As much as possible, we want the marriage to work kahit na mahirap. No? As much as possible, gano'n ang thinking, kaya nga mahirap. Wala tayong divorce, wala tayong annulment, but it's a very difficult process. I am in favor of divorce only for one reason. Yung po psychologically and physically abused partners, lalo na yung relationship that is very turbulent, irreconcilable, doon po, tingin ko pwede yan. Kasi nobody deserves to have a miserable life. Kung talagang irreconcilable na, nagbubungbugan, psychologically or physically, kailangan naman siguro mabigyan ng chance ang mabuhay na maayos. Nobody deserves a miserable life. So because of that, cover po ako doon for that reason. Ano yung isa?
Same-sex.
Same-sex marriage. Ako, very tricky rin. Pero, again, we are a predominantly Catholic and Christian country. I don't think we are ready for it right now. However, yung civil union, policies on civil union and property relations, I would agree because I want to respect the choices of individuals. No? So we can start from there, one step at a time. No? So, policies on civil union, respetuhin yung kanilang desisyon. Property relations, in case matagal na sila nagsasama, no? Kung mawala ang isa, dapat mapunta naman doon sa partner kasi sila naghirap doon. Diba? So, we can start from there and take it one step at a time. Well, actually, accidental lang yung pagiging food vlogger ko. It was part of my motorcycle tours and adventures. No? Dahil ako yung rider, kilalang rider, siyempre pag nag-ride ka, ang talaga hinahanap namin yung magagandang lugar, diba? Mga hidden treasures and also good food, no? Kasama po yan sa isang adventure ng rider, no? Kaya nga nung may private capacity during the time that I was in the Senate, so doon ako nag-concentrate. Nakilala nga lang ako sa food vlog, no? Na kasi siguro lahat naman ng pinupost ko talagang masarap, no? Of course, yung ano ko niyan, intention really is to help tourism, no? Especially in the pandemic. Wala tayong international tourism arrivals eh. So, kailangan natin magtulungan muna. We push domestic tourism. Ang hinahanap ko yung mga domestic, yung mga hidden treasures, yung mga hindi pa alam na maganda lugar. Dahil rider kami, alam natin yung pasikot-sikot, yung mga tabo, yung mga hidden treasures nga na hindi sikat, pero maganda. So, yun ang una kong pinapost. Tapos yung masasarap yan, mahulin the wall, hindi masasarap, no? So, doon ako nakilala. I think that's why I'm doing it because the multiplier effect of tourism, kahit domestic tourism, is really enormous, no? Pag nakita ng ibang tao yan, riders or even family na dadalhin nila sa mga probinsya, that time, bagsak na bagsak ang turismo, napunta ako ng Liga, nakakalungkot, yung Cali Cresolo ko, which na talagang dati, wala ka, hindi mahulog ang karayom dyan. Ganyan po, napakaluwag, no, nung time na yon. So kaya pinush ko ito. No? Kaya I'm thankful that Department of Tourism to the Tourism Promotions Board adopted yung Philippine Motorcycle Tourism, yung mototurismo, no, na pinupush ko noon. So, just imagine kung isang grupo ng riders o family pumunta sa probinsya, magpapagasolina yan, kakain sa restaurant, pupunta convenience store yan, for sure. Mag-check-in, bibili ng souvenirs, malengke. So just imagine the businesses, no, na iikot at matutulungan every time meron turista. So kaya tinulak natin yan. Especially yung mga food industries, yung mga small and medium scale, mga whole in the world na feature ko, nakakatuwa, na tinuloy-tuloy ko na kasi naging fulfillment ko dahil according to them talaga nagdoble, nag-triple yung kanilang sales, no? In fact, meron dyan isang popular pizza chain na dati iniisip na nilang ibenta. Nung feature ko na masarap, no? Sabi nung biglang lumakas lang yung sales nila. Kaya nang may nakikipag-usap, bibili na, hindi na raw for sale, di ba? So, yung mga ipanadahan, nabawa, dyan sa Sama, meron maliit na ano dyan. They were selling to 100 or 200 pieces a day. Ngayon daw, pati Paranaque, Manila, Quezon City, lahat ng order na. So, nag-triple or quadruple. So, that was my intention that in my private capacity, I was able to help the small and medium scale industry and the tourism industry. So, hopefully, matuloy ko pa rin yan. Matutuloy ko naman yan kasi rider ako eh. Di ba? And I think it will help stimulate economic growth and push domestic tourism.
And going...
Those are two very good issues, no, sa riding community. Una po, dun sa motorcycle taxi, yung angkas, tsaka yung courier services. When it was, dahil unahan din tayo ng technology tulad ng Uber at Grab doon, no, wala pang law, naunahan na yung technology at that time. No? So, that time it was being discussed, may mga apprehensions ang agencies and sub-senators to give motorcycle operation license, no, to operate as motorcycle taxi and delivery kasi dalawang gulong lang. It's baka hindi safe, no, kasi that's public transport. So sa totoo lang, I have to be honest, during that time I was chairman of the vice chair of the Committee of Public Services and Transport. Talagang ako rin as a rider, alam ko naman yung dangers niyan. But sabi ko, bakit hindi natin bigyan ng chance, no? So I was able to convince the OTR Secretary Tugade and the agencies na pagbigyan natin yung provisional authority for motorcycle taxi to operate. No, yung po Angkas, Joyride, and others. Tapos sumunod po dyan yung delivery services, yung courier services. So, dahil ako po yung rider, ako po yung nagtulak for them to be given the provisional authority to operate. So, sa awa naman ng Diyos, I'm quite nakahinga ako na yung kanilang accident rate is below 1%, no? Napakababa, maganda ang kanilang etiquette and training, disiplinado, kaya proud naman ako sa mga riders, no? Ng courier services, taxi services, and sila rin ang nagsilbing mga heroes of the pandemic, no? Sila po ang bumuhay ng ekonomiya natin nang walang nakakagalaw during the lockdowns. And who would have thought that a simple push of that provisional authority to operate would result in millions of jobs and livelihood. Maraming nabuhay na pamilya dahil yung mga motorcycle taxi and courier riders now are million na po sila. No? Kaya nakakatuwa. Siyempre, I just smile na, alam mo na, yung simpleng pag-push ko na yun na would have thought, would create jobs and opportunities. So, siyempre, happy naman ako na hindi rin naman nila tayo binigo dahil yung kanilang accident rate ay very, very low and they have remained disciplined and as disciplined riders and even serve as the heroes of the pandemic, as I mentioned, na talagang binuhay nila kahit paano yung mga negosyo during the lockdowns. Doon sa doble plaka issue, I think I was misunderstood there. Dahil po pumirma ako doon sa issue ng doble plaka, which riders did not like, nakapirma po ako, totoo. Kasi po, gusto ko magpresenta ng alternatibo. Baka hindi lang kasi naintindihan ng mga riders ang proseso ng lawmaking that after the Senate approves a bill, dadaan pa po yan sa bicameral conference. No? It's kung saan yung version ng Senate at version ng House pupunta po sa BICAM. Ang sabi ko sa sarili ko, sayang, no? Baka ito din pagkakataon, makapresent ako ng alternatibo, dahil ayoko rin ng doble taka. Then rider po ako, delikado yan, baka sa akin pa tumama. Sabi ko, bakit itong RFID scanner system na aking pinipresent would be a good alternative that instead of the plate numbers harap, itong RFID system na lang, na kung saan, kaya ako tinutulak yan because riders are one of the most discriminated sectors in the society. Pag may checkpoint, ang makotse, ang iba dadaan lang, no? Pero ang riders talagang pinabababa, tinitigil, pinabababa, ilalabas natin dokumento, ORCR, driver's license, ngayon po vaccine card. So malaking abala. Sila na nga yung nagtatrabaho sa atin, pero sila lang yung talagang pinabababa. Sabihin mo, pagpapasok ng Metro Manila o pupunta ng probinsya, siguro at least 30 to 40 minutes ang mawawala dahil minsan napakaraming riders, iisa-isa ng pulis yan, no? So, ang proposal ko was to come up with an RFID scanner system na kung saan lahat ng information nandun na po sa RFID. I-scan na lang pulis ng pulis. Pag green ng green, go lang ng go. Yung pupupula, yun lang po may problema, yun lang po ang i-hold natin sa checkpoint. So, that was my proposal. It was really to eliminate, if not minimize, discrimination on riders. Napakaganda po ng intention ko. Nakakalungkot na marami sa riding committee, hindi pa sa riding committee, hindi po naintindihan and were misled by some leaders na meron po silang kandidato in 2019. So I have mentioned that several times, kaya sana makabalik po ako, matutuloy na yung RFID system. Nandun na yung sticker kaya lang doon wala ako, wala nagdepensa at naglagay ng budget to buy the scanners to set up the command center. Sana po ngayon kung nandun pa ako, na-set up ng command center, na binili yung scanner, hindi nahirapan ng police, hindi na rin naging abala sa riders. That is the only way we can minimize discrimination with the use of technology. Otherwise, talagang mano-mano yan. Kawawa ang police. Nakakadulig din magbasa ng OR at CR ng ilang daang riders, di ba? So it's convenient for the police, it will be more convenient for the riders. So napakaganda na aking intention. It was just misled and misunderstood. So marami na ang sumusuporta sa akin kasi naintindihan na nila.
Next question.
Yes, good afternoon, Senator JB. I'm John Buena from Kumiko.com. I'm a men's lifestyle blogger. First off, congratulations po sa pagkaka-include niyo sa recent surveys on, of course, the top 24 senatoriables. And you came in at a really, really high rating with that. Part of your voting population is, of course, also the youth sector. What are your plans for them and also for education? Can you tell us more?
Thank you for that question. Actually, in 2013, I ran on the platform of youth advocacy. Because medyo bata pa naman ako noon.
Yes.
And I've been a youth leader, no? Nag-leadership development organization ako, JCI. I've been member of several youth organizations. So, tinupad naman natin yung pangako yun. No? I am also one of the principal authors pala of the Free Higher or Tertiary Education Act na kung saan bawat state universities and colleges, lahat po ng mag-aaral dyan, libre na po ang tuition. No? So, I'm also one of the principal authors. That's already being implemented. Second, yung pong Sangguniang Kabataan Reform Law, I'm also one of the principal authors of this measure. No? Na I remember, it's a collaboration. Kami po ni Senator Bamakino, ang author niyan, principal author. Tapos si Senator Marcos po, ang Bongbong Marcos, ang chairman ng Committee on Local Government. So, naging author na rin po siya. So, it's a collaboration between Ejercito, Aquino, and Marcos. At least sa isang batas nagkasama-sama man lang. So, there was a strong clamor for the abolition of the SK before kasi naging believed out for corruption, racial politics. Well, might be true. But I told myself, sabi ko kung mawawala yan, lalo mawawala ng programa pang kabataan ang ating gobyerno. So instead of abolishing, let us reform. Ayusin natin. So yun na po nangyari, tinaas natin ang age, tapos yung programa dapat concentration on leadership development organization, leadership training, tapos youth welfare, no? Entrepreneurship and other youth welfare activities. Huwag na po yung mga kung anong ginagawa noon. So, it was passed sa Sangguniang Kabataan Reform Law. So, at least on the on the youth advocacies, I guess I have fulfilled my promise to the Filipino youth. Dalawang landmark legislation for the youth, Free Higher Education Act and Sangguniang Kabataan Reform Law, of which I'm also I'm principal authors of both.
Alright. Off topic, but Senator, of course, you're running as an independent, but how did you feel when some of the bigger parties that you were expecting to carry you didn't actually do that?
Well, to be honest, it was a puzzle for me. I felt bad kasi unang-una malinis sa track record ko, wala akong issue, wala akong sakit. Hindi ako magiging bagahe. 18 years of being a public servant, no issue of corruption, undamaged track record, so hindi ako magiging bagahe sa sino man ang mag-adapt sa akin. Second, I have performed as a public servant. As mayor, I was the 10th outstanding young man awardee for public administration as mayor of San Juan. I was able to govern San Juan very well, naging city ang San Juan under my watch. Lowest poverty incidence sa buong Pilipinas ang San Juan. As congressman and as mayor, I was able to pass quite some significant laws. Of course, the two landmark legislations, Universal Healthcare Law and Department of Human Settlements and Housing, and Urban Development. So, it remains a puzzle for me kung ano yung kanilang basis for selection of candidates. Probably it's not performance and track record, kasi kung yun ang pagbibasihan, which should be the basis. Mukhang pasok naman ako doon. So probably it's popularity and political ang nag-reasons nila.
And how does your family feel about it? Did Mayor Gia tell you something?
Well, she feels bad kasi she's, lalo na sa that time, my father was one of the last to leave Malacanang during the 86 revolution because he was mayor. Natulungan man siya ni President Marcos and First Lady din as mayor kasi maliit na bayan lang sa San. My mother was one of the loyalists noon, nung panahon na yun. Nag-irgas yan, maibang sa Manila Hotel, at kung ano, syempre, sabi nga niya, parang nakalimutan na kaya yung mga sakripisyo ko. Parang yun lang. Actually, it's my mother who really felt me. Ako more of puzzle. Kasi I have a good track record, I have a good good performance, kaya a good one eh. Diba? So, I would have been, modesty aside, I would have been a plus factor on any presidential team. Kasi wala nga akong bagahe at meron akong performance.
And sir, did it feel better that you actually are able to get high ratings despite that?
Oh yes, I think it's already short of a miracle that I am figuring high right now kasi napakabigat talaga itong pinagdadaanan ko. Kaya nga highs and lows to. Lack of funds, because I just ran 2019, bigat-bigat na national election talaga. Prepared ako ron dito, hindi ako prepared. Wala akong major party, wala akong nasasamahan presidential team na with the built-in crowd. Tapos may kasabay pa akong kapatid. No? These are all factors, no? Na for me to barge in the top 12 and rank 7 or 8 in some survey firms is, I think it's short of a miracle. May tulong na ito sa team kasi napakabigat talaga pinagdadaanan ko. I think I have really a mission to fulfill kaya siguro natutulungan ako.
Alright, congratulations sir.
Next question.
I really have one thing in mind, no? Talagang priority is really to fully implement yung UHC. This pandemic actually made me decide, no? Na sabi ko nga, mabigat ang laban, pero lalaban tayo kasi nga, sana mas lalo maramdaman tulad ni Ma'am kanina, may mga concern siya na baka hindi alam ng tao kasi hindi pa fully implemented, hindi pa fully informed at iba. So, it's really important that the wisdom of the principal sponsor is there to guide and oversee the implementation of the Universal Healthcare Law, Department of Housing, Infra Development, among others. So, ako po yung nakikiusap sa ating mga kababayan na sana po yung mapusuan niyo muli si Senator JB Ejercito. Marami pa tayong kinakailangan talagang ayusin, no? Sa pamalaan, marami pa tayong kailangan gawin, pero gagawin natin lahat yan. Kaya ibalik natin ang Google sa Senado, JB Ejercito po. Number 22 sa balota, mabuhay. Thank you.
Okay, thank you po. For media,